Jeffrey Skubic, Jeffrey, last name Skubic, Skubic, Trauma Medical Director here at DHR Health.
Dr. Skubic, what's been happening here today?
We're launching a new initiative. It's our DHR Health ATV Injury Prevention Program. This program is after we have recognized a large amount of ATV injuries in our community. 183% increase actually, and Texas is the highest rate of ATV injuries in the nation.
Is that growth not simply because DHR is growing itself, or are we really having more accidents?
That's a great question. DHR is growing and receiving more and more of these patients, but at the same time, all the local hospitals here as well have increased their capacity for trauma patients. So despite other large hospitals, also another level 1 in the region, another level 2 in the region, we still see the increase.
In the press conference, the announcement of the program today, we heard that this is the only program of its type south of El Paso.
That's correct. It's the only one down here in South Texas, but there's such a need for it. We're dealing with these injuries on a regular basis, and some of them are minor fractures, minor ankle fractures or humerus fractures, wrist fractures, but some of them are just catastrophic. I mean, these families are never the same sometimes. It's horrific.
How long have you been working on setting the program up?
We've been working on this about a year. Really the lead for it and who's been doing all the legwork is Cassandra Bravo, who's our injury prevention coordinator here at DHR Health. And this was her idea, this was her baby, and she actually went and became an instructor, certified in the course. So she's going to be the one giving the course this Saturday, the first one down here.
And you had the blessing of Sheriff Guerra as well. He was on the podium with you.
Because sometimes law enforcement sometimes are the first ones on the scene. And so they see the result of these catastrophic injuries, the patients laying there with broken bones or paralyzed. And then EMS comes after them. So they too recognize that from a law enforcement standpoint, this is a public health problem.
How are you going to get the word out about this program to prevent folks from having such accidents?
Press conference like today. That's the whole goal, is to try to spread awareness of this. Even if not everyone comes and takes the course, which we welcome them to do. It's free, it's voluntary. Why not come take it if you're an ATV rider? But even if only a few people take it, but those families are saved, or just by them hearing about the course, it spreads awareness of, hey, these things are dangerous. Maybe I shouldn't be riding it after I've had a few drinks. Even if we can do that, we can make a difference.
Dr. Skubic, is there anything else you'd like to add?
Just that we're going to be continuing to increase this program, and I would hope to even continue to spread it across the whole Rio Grande Valley, partnering with other institutions and continuing to do that, and then we'll have to do research on it again and see if we've made a difference. So I think this program will continue to grow and won't go away.
Thank you so much for today's interview.
Thank you. Nice to see you again.